My name is Rabia Chowdhury, and I'm a Master's of Health Informatics student at George Mason University. This presentation is on Howard Community General Hospital's performance on timely and effective care. There were 5 measures that were being evaluated, and these were all tied together because these are timely and effective care measures that can be generalized for any illness. The first one, for instance, sepsis care, involves antibiotics or fluid treatment, and this can be for any illness where there is an infection. Second is admit decision time to ED departure time for admitted patients. Third is the median time from the ED arrival to ED departure for discharged ED patients. 4 is newborns whose deliveries were scheduled early when a scheduled delivery was not medically necessary. And 5, patients that left before being seen. The data for the hospitals was retrieved from the CMS Hospital Compare website. Limitations of the data was there were data that were either not available or had inconsistent data periods, and a 5% error rate. The competing hospitals I chose were Mercy Hospital, the Johns Hopkins Hospital, and the University of Maryland Medical Center. These 3 competing hospitals were chosen because they are relatively close to Howard County General Hospital, but they were also the hospitals that had all the measures and data that I was looking for, and the lowest not available rate. When talking about sepsis care, it can be seen that Howard's average fell right in between the upper and lower control limits, with a slight decrease in the score coming towards April of 2018 to March 2019. Talking about admit decision time to ED departure time for admitted patients, it can be seen that Howard General falls in between the upper and lower control limits, with a slight increase towards April 2018 to March 2019. For median time from ED arrival to ED departure for discharged ED patients, it can be seen that Howard General remains pretty constant in the score. However, the score dropped towards April of 2016 to March 2017, but it still fell in between the upper and lower control limits when talking about competing hospitals. For the measure where newborns whose deliveries were scheduled early when a scheduled delivery was not medical necessary, Howard's average stayed at a constant 0. However, this was still between the upper and lower control limits. When talking about the scores for patients that left before being seen, Howard County General Hospital had an average and constant score of 3, which still fell in between the upper and lower control limits. To summarize the findings of Howard General Hospital, the score pretty much remained constant for most of the measures, with slight increases and decreases for one time period. The score was always between the upper and lower control limits, however. Thank you for taking the time to view and listen to my presentation.